Good afternoon, San Diego. This is Dr. Jason Shumard with Integrative Wellness Center of San Diego. And today we're going to continue our conversation on why is my thyroid not working. This will be part 3. So if you have not seen part 1 or part 2, then make sure you look back on our video series here and you'll be able to look at those. But today I want to start by just going and reviewing just a few things from our last video, the part 2 and part 1. What we spoke about in those videos is where many individuals who are suffering with thyroid conditions, they go and get a diagnosis by their doctor. They get their pharmaceutical medication. Usually it's some sort of thyroid hormone replacement, levothyroxine, Synthroid, something like that. They start taking the medication. They don't feel better. They continue to get worse with time. And then over time, they continue to start taking other additional medications for the other symptoms that they're experiencing that are not being addressed. And so we talked about one of the things is that you want to make sure that you are analyzing or getting analyzed appropriately. Those are different markers that need to be ran through blood work to verify if you truly have a thyroid condition or if it's some other mechanism that is involved with the thyroid, some downgraded versions. Sometimes there are other organs or tissues or systems that could be disruptive or are dysfunctional. And when they're not working properly, you're going to start to have symptoms that are very similar to thyroid symptoms. So I call that a misdiagnosis. So if you want to look back on those videos, I went over a little more in depth. I want to be cautious of our time today and focus on the next part of this video series here. So the next component that we're going to talk about today is probably one of the most important components in regards to thyroid. And that means because this situation, this condition or problem that most thyroid individuals are dealing with. So if you have a thyroid condition right now, it is likely you are dealing with this specific problem. The statistics tell us about 90 to 95% of all thyroid cases are due to this specific condition. And that condition is called Hashimoto's thyroiditis. Now, Hashimoto's thyroiditis, some of you have maybe heard of this condition. Some of you may be thinking I'm speaking another language, but this is such a common problem, which is why I wanted to do a video about this today. Basically what it is, it's an autoimmune disease, meaning that your own immune system is attacking and destroying your tissues of your body. In this specific case, it would be your thyroid. So some other types of autoimmune diseases that you may be familiar with would be rheumatoid arthritis, maybe type 1 diabetes, lupus, celiac disease, those sort of things. So those are pretty significant conditions. Many individuals who are dealing with those types of conditions are very ill, and Hashimoto's thyroiditis or Hashimoto's is no different. It's just as significant, it's just as problematic. The difference is it's the thyroid and not some other tissue like the pancreas or the intestinal tract. So what's really going on here? So what happens is that the immune system starts to attack and destroy and literally eat away and kill the thyroid over time. So as it's continually eating away and destroying the thyroid day by day, month by month, year by year, eventually the individual starts to experience symptoms. And those symptoms are going to be thyroid symptoms, right? So they're going to have fatigue, they're going to have weight gain, and they can't lose the weight, and they have no energy to go do anything. They're losing their hair, they're irritable, constipation, anxiety, depression, all these things that are associated with traditional thyroid problems. So the person goes in to their doctor, lets them know that they have a thyroid or they're having these types of symptoms. The doctor says, well, it sounds like you may have a thyroid issue. They run the blood work, and the whole story goes on again, like we've discussed before in other videos. So this person is set off on a wrong stage because they're not being diagnosed appropriately. Most of the time, when you get this, when the thyroid is diagnosed as hypothyroidism, you're going to get a medication like levothyroxine, Synthroid, some sort of thyroid hormone replacement. And then over time, as you progressively get worse, it's just taking additional medications to address the symptoms and never addressing the underlying problem. In this specific case, it would be the autoimmune disease, which is Hashimoto's, which is the most common cause of thyroid problems. This is very important. 90 to 95% of all cases have this as their cause. So if this is so common, if it's such a problem, then why isn't your doctor running these tests? Why aren't they analyzing? Why aren't they testing for this? And by the way, you can test for this. Very simple. It's very inexpensive. It's very easy with a little blood test that can be done. Because autoimmune diseases are very, very dangerous. They can be very disruptive, causing tons of inflammation. And on top of that, they increase the risk of other autoimmune diseases. So if you have an autoimmune disease right now, say you have rheumatoid arthritis, or you have celiac disease, or colitis, or something like that, that's potentially, those are autoimmune diseases. So, and if you have a thyroid condition, then it's likely this is your problem. You actually have Hashimoto's. So what is important to understand is that if you are giving a thyroid hormone, it's not going to help you, because it's not going to address the immune system if the immune system is the cause, meaning if you have Hashimoto's disease. So as the immune system continues to destroy and kill the thyroid, well, you can keep on taking the thyroid hormone and maybe it makes you feel better, maybe it makes things look good on paper, but it's not fixing the problem because it's not addressing the immune system. No, it's like if someone were to, I use this example all the time in some of my live events, so it's a bit aggressive, but it gets the point across. But if I were to come up to somebody every single day and literally punch them in the face for 30 days straight, now over time, their face would be bruised up, inflamed, swollen, maybe a black eye, maybe they have a broken nose. I mean, it'd be a mangled situation if I kept punching them in the face every single day. Now, in that scenario, is their face the problem? Now, I say that jokingly, obviously. Of course, it's not the problem. The problem is me punching them in the face. But think about this. In the medical avenue right now, if you have Hashimoto's disease, which is no difference than me punching someone in the face because the immune system is attacking, destroying, and killing the thyroid, well, then what sense does it make to only address the hormone production of the thyroid and not fix the immune system that's causing the issue? It makes no sense whatsoever. And the main reason is that there is no real treatment in the medical model. There's no drugs, there's no pharmaceutical drugs. If things worsen to the point, maybe they give you a steroid, maybe they give you some immune suppressors, but that's not going to fix the issue. The immune system is still